So I wanted to actually ask you a few questions about networking, because I know that you were talking about how you started your career initially in finance. I think it was through pretty much networking. You got that job based on like who you knew, and the opportunity presented itself. And now you're possibly going to begin a career in academia because of who you know. Is that correct? So how important is networking, and how important would networking be for an undergraduate student who maybe hasn't even graduated yet and they're just starting they're working on their bachelor's degree in healthcare management?
Networking is absolutely critical, important, and is key. So through LinkedIn, it's one of the tools that I actually utilize in order to make connections within the industry. I think I connected like that with you. Yeah.
That's how we connected. Yeah.
That's correct. Exactly. So it's a great tool, to connect with different people within the industry. Also, but you have to know how to approach people as well. You have to know how to, don't just go and ask, hey, do you have a job for me or something,
Right.
You can't do it like that. You have to have a different angle on it, so also going to, I know they have conferences in the healthcare industry where you can attend. They also have online conferences, not only in person, but online. You have webinars as well. I've met some people in the webinars I attended as well, which I still connect with them. So wonderful. It's a wonderful way to meet people within your industry, and it's particularly what you want to do. It doesn't have to be healthcare, just anything. Also, your professors. Your professors can be a great source of information. They know a lot. They have experience in healthcare. I don't want to put you on the spot, but and I'm sure they can.
I'm used to it.
Right.
I mean, it's happened so many times. It's actually what led me to even start doing this, to start growing an online presence, because it seemed like, well, during the pandemic, I was, doing this, but during the pandemic, when I started to bring whatever value I was giving to my students and put that online, then I gave access to everyone else, and it seemed to take off from there.
Sometimes people find jobs through internships, look for those. Sometimes they're offered through your school, and there, once you're in those facilities, just make connections, introduce yourself. Don't be shy, just take risk, step out of your comfort zone. That's one of the things that I would say, because you never know who you're going to meet. You're going to meet that person that actually is going to offer you a position. It's all in your approach too, be respectful, be professional, provide, your interest, your skills, and so on and so forth. Of course, we don't know everything, right? But showing how you can provide value, be willing to learn. Also, that's another important thing.
Be willing to learn and provide value. Yes. Absolutely. I agree so much. I do want to ask you, because you did mention webinars and conferences and whatnot, and that you've attended webinars. So where do you find webinars?
Fortunately, that comes from my professors. That's why
professors.
Yes, professors, correct. So I get in contact with professors that I've had in the past, and they send me links to certain events that are happening, in which I've registered. I don't have the names of those things. Maybe I can provide that for you later, and you can probably post it in your description.
Yeah, that would be great, actually.
Yeah, I cannot. I don't have it right now. I didn't expect that question. So
whenever you can, that would be great if you could just send me a message and provide those links, and then I'll put them in the description.
So that's what I do, and they send me. It's sort of like a newsletter. They keep you updated with the upcoming webinars. They talk about trends within the healthcare industry, and they go in detail about it. So like opioids, that's a trend is still going on. It's like just because COVID is here doesn't mean that the opioid epidemic has gone away. No, it's still an issue. They go into detail with these webinars, and I've learned so much. I've gained so much information like that. Yes, I'm done with school, but that doesn't mean that I stop learning. So continue learning. That's another way. That's why I attend these online webinars, just to keep up with what's going on in the industry. I also follow a doctor. I don't know if I should call him out, give him some shine, but on YouTube that provides great information with what's going on today in the industry, in the healthcare industry.
The last thing I want to ask you is, what advice do you have for undergraduate students, new grads, and also just people looking for an entry-level job, just anyone new in the industry?
I'm going to be very honest, okay? Very honest, because even though there's a need for staff all over the healthcare industry, I have found that it has been very difficult to break into the healthcare industry without experience. So that's why I say, try and apply to those internships. I'm not a fan of free internships, but you have to make exceptions. Right. I'm not a fan. But
I also like money. I think most people like money.
Yeah, but because you need to survive, right?
Of course.
But if you have an issue, maybe that is one thing that you can explore, right? Mm-hmm. So I want to let them know that it's not easy right now, even though there's shortages. So that is the reality of what's going on. High demands in different positions, of course. Like nursing. Maybe you want to explore nursing, because I understand that many are retiring. Not only physicians as well. They are retiring. They are older age and stuff. So that is another career that maybe you would be interested in. It doesn't have to be in administration, but you can venture techs. Those are all careers where there's a need. But definitely look into internships. That's what I would say, because it's tough right now. I can tell you firsthand. It's not easy to break into the healthcare system. But just because it's difficult doesn't mean that you shouldn't try. Continue applying to the different positions. I know they're the different entry-level positions. They call them entry-level positions, but they require 3 years experience in their entry level. This is what I'm trying to say, So I don't want to paint a picture that you're going to get a job right off the bat when you graduate with a bachelor's degree, or undergrad. It's going to be difficult. It's going to be challenging. Expect it. So again, you have to make networking, like we were talking before. I had to bring it. That's also very helpful. So internships, network. You have to talk to different people. And if you are bashful, you have to get out of that shell, because it's all about fear at the end of the day. When you are afraid, you have to take a chance. Just take a leap of faith. Bet on yourself, and take a risk. Go for it. Mm-hmm. Go for it. If this is your purpose, then believe in yourself. Believe that. Prepare yourself. Continue learning. Don't stop learning right after. Just because you graduated, everything. You don't. There's so much to learn. I don't. I have a master's degree. You have a PhD. I still don't know everything. There's so much to learn. So be a lifelong learner. That's another thing that I have to say. Prepare yourself. Always prepare yourself. There are certifications that you can take, that you can earn. Go after, like the CPHQ, the quality, healthcare quality certifications that you can go and pursue. So many areas where you can take a career path in the healthcare industry.
I know that's so valuable, and I agree 100%. It's not easy to actually land your first, especially your first job in healthcare administration or healthcare management. No one's gonna make you a manager as soon as you graduate. It's just not.
It's not gonna happen. It's not gonna happen.
It will not happen. You're going to have to start from the bottom, and even at the bottom, you're gonna have to have some sort of healthcare experience. This field is super competitive.
It is.
And in the beginning, it almost feels like this exclusive club that you can't even break into. You're not on the list until you meet important people, and then eventually you get to go onto the list and get your foot in the door and start moving around. But to get in, to get on the list, that's where network comes in. You have to go do internships, shadowing, volunteering, webinars, like you said, conferences. Another thing that you can do is, especially they have these more for those who are in grad school, but you can do a case competition. And so you can team up with other people in your school and enter a case competition. And basically it's a case study that applies different levels or different subjects. Pretty much it's almost like you're applying everything you've learned so far in this field to solving this case, and then you present it formally. And I think now it's just you send in your presentation, and then they'll judge you, and then they'll score you against all the other contestants or all the other groups, and they'll give you a place. And if your presentation is going to go up in front of a lot of Fortune 500 companies and whatnot, and they're all going to see these new people coming in who have all this knowledge and who are applying everything that they have to this case study, and they're doing a good job. And so if you can really show off your skills at these case competitions, that would benefit you a lot, so much. So I think that's also a way you can jumpstart a lot of that networking, because you are going to showcase your talents in front of a lot of important people. So they're actually noticing you, which, whether you win or you don't, you're being noticed. So that's something huge. I don't know if you want to look into that for yourself or you're completely over that. But
no, I get it. I wrote a bunch of papers, case studies. So I'm aware of that, actually.
There's also getting your papers published. There's a lot of ways you can get noticed in this industry, but
exposure.
It's not easy.
Exposure,
you have to be exposed, and you have to get connected with people, and that's really the only way that you're going to get in. It's not as simple as just applying to a bunch of jobs on Indeed and going, me. Because if that's all you're doing, and you say, God, I applied to so many different jobs today, you're not going to get any of them.
Right.
So it takes a lot of work.
And that's a huge mistake. Every time I apply to a position, I format my resume to the job, because one size fits all, that's not going to cut it. You're not going to get called. And even if you format it, it's still, you have a hard time, but guess what? You have a better chance of getting at least an interview. So make sure that whatever position you're applying for, format it for the position you're applying for.
Absolutely.
Very important. Some people just send the same resume to all the positions.
You can't do that anymore.
No.
Or maybe you can for other jobs, but you really can't do that in healthcare, especially if you're trying to. The healthcare administration, especially, you cannot do that for. In a way, nursing, since there's such a demand. If you're applying as a clinician, especially with nursing, you can kind of do that. But, in so many other fields or other positions in healthcare, you cannot do that if you want to survive and get a job. 100%
agree with you.
Right. Well, it's been a pleasure. Thank you so much for doing this. I think that we've all learned a lot from you and your experience. You definitely provided a lot of value for us on both ends of healthcare through a patient's lens, and also now you're working in healthcare and going through the system, and you're even going into academia. So that's all impressive. You've been on every side of this system. So that's really cool.
That's the plan, to go into academia. That's the plan. I'm not there yet, but that's where I would like to. Thank you. Appreciate that. Absolutely. I thank you for also inviting me onto your platform as well. Greatly appreciate that, to share my story.
No problem. It was a pleasure.
Thank you.
And take care.
You as well. Take care.
Take care.